Hello, my name is Oscar Viera. I'm a student physical therapist assistant, and today we're going to be going over how to use the TENS unit. So I'm going to go ahead and bring you over here. Okay. So this is the TENS unit device that I have at home. This is already connected. I kind of preset some things. So I'm going to go ahead and turn it on. So go ahead and turn it on, right? It tells you right there the modes, right? The different modes you can select from, and it'll switch on and off. So we'll go back to N. N is normal. We're gonna go ahead and leave it there. This TENS can go from conventional use and acupuncture use. The acupuncture use, the difference is that the pulse frequency goes from 2 to 5. And the pulse duration is 0 to 300, and it's more of a tingling and a muscle twitch sensation that you get when you're using that acupuncture setting. What we're going to go over today is going to be the conventional use for the TENS unit itself. So for that, we're going to have to set the parameters. So I'm going to go ahead and start that. Bandwidth. So the bandwidth here, so we go to mode and we go back to normal. Okay, so normal. Okay, so the bandwidth here is going to be set to we're going to bring it down to between 50 to 100. So I'm going to go ahead, we're going to go ahead and leave it for 100 today. So that's the pulse duration. Pulse rate would be the megahertz here, and that's going to be the pulse frequency, right? And that can be anywhere between 30 to 150. So go back. Okay, so we're gonna go up to about, let's go 80. So we're gonna go up to about 80. Once it gets up there, almost there. Cool. So what this does, it allows the patient to go under something called gate control theory, and that helps to reduce pain that a patient is feeling. So for this one, I'll place it for 10 minutes just in case, just so I have enough time to explain everything. So yeah. It allows the patient to go under this thing called gate control theory, and it helps with pain reduction. The only difference is that with TENS, it only works when the device is on, right? So once the device is on and they have it attached to whatever muscle group it is, it's going to help them reduce their pain symptoms. And the sensation that they should be feeling is more of a tingling sensation. And the duration can be, it can be for as long as they want, but obviously intermittently, so they're not like always on this device, because then they'll be in euphoria, and yeah, it wouldn't be a good thing when they come off of it, right? So first things first, before I get it started on myself, so this one is on channel 2, right? So that means that my right side, this side of the TENS unit is on. Right, so this side isn't on at all, right? So I'm gonna go ahead and place the pads on my forearm or elbow area. So first things first, what you would do if you would have some wipes, some alcohol wipes, is to wipe down the area that you're going to be using, just to help eliminate any like essential oils that patients use or lotions, anything of that nature, and it helps the longevity of the pads themselves, right? So I'm gonna go ahead and place that on me really quickly. I'm gonna go ahead and place you down here real quick. All right, so that is how you place the electrodes in there, right? And you want it to be across, right? Just how these are right here. You don't want it to be right next to each other either, right? You want it to be that the central area of pain be right in the center as well. And the good thing about this one is that you get to control the amplitude, so the intensity, based on the patient, right? And again, it should be more of a tingly sensation than anything. So there shouldn't be like a muscle twitch, right? It shouldn't be doing this, right? It's more of a tingly sensation. I like to say more of a staticky sensation. And they get to control it, right? In here, right? So I'm gonna go ahead and pump it up a little bit. Okay. So right there, I'm starting to feel more of the tingling sensation that I was talking about, right? And the good thing about this one too is that the patients kind of get to dictate the amplitude here. And yeah, so that's how you use the TENS unit. And again, this only works when the device is on, right? So as soon as you turn off, the pain symptoms might come back for the patient, right? But yeah, so that's the TENS unit. And this is my home one that I have here at school. It's slightly different, but pretty much the same thing for TENS. And yeah.